My name is Bednash. I am the Chief Executive Officer of a national organization that has schools of nursing as its members, and we're located in Washington, D.C., and we have 700 institutions with 250,000 students and all people who are just dying to be nurses. I chose a career in health very much by accident. I was in my first day at college. I didn't know what I wanted to do. I was with a very good friend who'd gone to high school with me, and she said, "Oh, come with me, let's do nursing." And she said, "And you know, if you don't like it, you can change your career. You don't have to stay there." And by the way, she's a librarian now, and I'm the nurse. But as soon as I began my nursing coursework and got to understand the impact that nurses can have on people's lives and the wonderful care that we can provide people to help them be healthy, to help them get through illnesses, and the joy of working with people as they go through good and bad times in their life is so rewarding. And to know that you're making that kind of contribution to keeping people healthy, to moving them along to a healthier place, it's just a marvelous, marvelous contribution you're making to others. So it caught me, it captured me, and I've loved it, and I've loved it all the time, and I never regret that very serendipitous career choice that I made. I never thought I would be doing what I do now, and I think of myself as a nurse now, even though I sit in an office and we write policy about what nursing should look like or what the education should look like. I began my career working in a hospital, working as a staff nurse. I was in the Army and spent time in Vietnam. I also was in several military Army bases. I taught nursing. I worked in public health. I worked in the operating room at one point. I worked in the emergency room at one point. I taught in public health. I am a nurse practitioner and saw patients in a family residency program and worked with physicians to do primary care. And so those are all examples of the joy of nursing. Nursing is so versatile that you can practice it in so many places, and it's been an evolution of my career. One of the things that's changed my practice is my education. The more education you get, the better you can be at it. And I do things now that I never thought I would be able to do when I left that nursing program, that very first program, and moved into a hospital employment situation. All of those settings were fabulous places to be, exciting places to be. But the great part of nursing is that you can grow, you can expand, you can shift, you can do different things, and all the while, you're still a nurse.